The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. We are so excited that so many folks across the country could join us today. And as we share a little bit about our work and the impact we're seeing of this pandemic on survivors of violence and on our immigrant communities. This presentation is kicking off a 4-part e-learning series we're doing in conjunction with our annual Bighearted campaign, which I'll share more on later. But for now, my name is Christine Spencer, and I am the Community Engagement and Strategic Partnerships Manager for Tahirih's Greater DC office, which serves the DC, Virginia, and Maryland regions. I'll be monitoring the presentation and the discussion today. And I have the great pleasure of introducing 2 of my wonderful colleagues and today's presenters, Adriana Lopez and Chelsea Naylor. Adriana is the co-director of client advocacy, and she serves all 5 of our offices across the country to help develop our interdisciplinary model of social services and legal staff who work together as one team to holistically address client needs and increase survivor access to safety and justice. And Chelsea is a legal advocate in our Greater DC office. As a fully accredited representative through the Department of Justice, she practices before both DHS and the Executive Office for Immigration Review, which includes the immigration courts and the Board of Immigration Appeals. Her work focuses primarily on U visas, T visas, VAWAs, and adjustment of status. So Adriana and Chelsea, thank you so much for being with us today, and I turn it over to you.
Great, thank you so much. We are so excited for everyone to be here. I think that many of you are familiar with Tahirih, but for those of you who are just learning about us and just starting to get a little bit more information, welcome. We are so excited to have you. So just a little overview, Tahirih is a national nonprofit organization, and our goal is to support immigrant survivors of gender-based violence. So this might look like people who have either endured or survived or been threatened to undergo female genital mutilation, forced marriage, sexual assault, domestic violence, human trafficking, be it labor trafficking, sex trafficking, and many other things. One thing that we're really proud of here at Tahirih is that we work in a holistic interdisciplinary model. So we have our different teams working really well together and really closely together to make sure that we are providing the client with everything that they could need to really reach safety and thrive in their community. Next slide. And you can see that the ways that we do this there's really quite a few. Primarily, what most people think of when they think of Tahirih is our immigration law program. So again, we work with survivors of gender-based violence. So we're working on things like the U visa for survivors of crimes that happened here in the US, T visa for human trafficking survivors, VAWA and the battered spouse waiver for abused immigrants, spouses of US citizens and legal permanent residents, asylum, both defensive and affirmative, and SIDGE. We also do green card applications for clients who have those underlying remedies. So in conjunction with the immigration law, we also have family law, where we're able to help with protective orders and divorce and custody for some of the clients in our immigration law program who have that need. Working in conjunction with the legal team, we have our social services team, which is a really critical part of our holistic services. They're able to really address the life needs of the client and again, center them and make sure that they have what they need to really be able to thrive. In addition, we have a really great forced marriage program where we're able to help women who are being forced into marriage either here in the US or if they're brought abroad. We also work on civil law, so appeals, for example, and trying to access medical services for our clients. So basically, with everything that we want to do, we want to make sure that we are working in partnership with our clients and that we're working to center them and amplify their voice so that they can have the best life that they can and that they can really shine and thrive.
Thank you, Chelsea. This is Adriana. Thank you, everyone, for joining. So if you have been reading the news, you may already know that nationally, the COVID pandemic has had a disproportionate impact on Black, Indigenous, and other communities of color. The pandemic has really put front and center the economic and health inequities that these communities face and the many barriers that they have to go through to access basic human rights, such as medical care, food, experience food security, etc. Next slide. Really, the pandemic has come to impact all aspects of our lives, but it is true that for immigrant survivors of gender-based violence, they do have unique vulnerabilities right now. And so what we are seeing in the communities that we currently serve is that on the one hand, our clients are working in industries that have been decimated really by the pandemic. That would be industries like the hospitality industry, the restaurant industry. I know in the Greater DC office, for example, where I used to be the former, or where I used to serve as a social services program manager, a lot of our clients work in cleaning offices or in the hotels, etc. And so because of obvious reasons, because of social distancing, etc., those jobs may not necessarily be there anymore. And so our clients have experienced significant employment loss. And then you have the other camp of our clients who are working in industries where they are considered essential workers across the country. That may be whether they're working in grocery stores, farms, factories. And so that puts them at greater risk of contracting the virus. And so all through the summer, what our teams were trying to coordinate and organize was making sure that for those clients who are considered higher risk of contracting the virus, that we were creating or providing access to PPE equipment, making sure that their families were safe. For clients who did contract the virus, particularly focusing on making sure that their children, if the children were at home, that they had access to food so that they could also properly self-isolate, prevent further risk of infection, and making sure that they were taken care of, because a lot of times our clients are the main source of revenue for the home. The reality is that most of our clients tend to be concentrated in low-paid, unstable, risky jobs, and so they are less likely to have health insurance. So our staff spend a lot of time, and this was true prior to COVID, but it's also true now, that we spend a lot of time trying to locate or identify financial resources to be able to pay for basic services. Our staff spends a lot of time on medical bill forgiveness programs, helping clients apply for those so that they don't feel like they have to forgo the care that they need. The other thing that we have seen with our clients is increased risk of re-victimization, both in the private and private realm. What does that look like? For our clients, it looks like abusers, survivors who are still living with the abusers. So for our staff members, sometimes it means having to adjust schedules to make sure that we can talk to the client when it is safe to do so about continued safety planning, about preparing for their legal case, making sure that perhaps children are not around so that they don't get to hear details about abuse that they might not necessarily be aware of, and that we don't want them to hear because it may create some trauma. It also has meant for some of our clients that because they are in a vulnerable situation, because they maybe lost a job or don't have childcare, that abusers are trying to reinsert themselves in the client's lives or their children's lives and are actually threatening to take children away. And anyone who has worked with survivors knows that the threat of losing children often persuades clients to not pursue justice or remedies that they qualify for because they're fearful of losing their kids. We know that our clients are isolated. We know that there are lack of resources. When talking to our staff members, they typically share that what used to take an hour or two now may take sometimes 5 hours because they're trying to locate resources. They're trying to call different entities and constantly getting a no. We don't have any more space for this shelter. We don't have the funds that were typically available to support clients with financial assistance during a crisis. Those funds are depleted, and so we're having a harder time being able to connect our clients to some of those resources. And it is also true that any relief that was made available earlier in the year because of the pandemic, typically our clients may not necessarily qualify for those because of their undocumented status. And so it has created or exacerbated, I think, the lack of resources that our clients can typically access. And then we've also seen that there is housing instability. Again, we have had a hard time sometimes placing clients who are facing homelessness in DV shelters or homeless shelters. We, for example, recently had a client who had escaped a trafficking situation, was placed in a shelter only to find out weeks later that the shelter was closing. And so our staff was scrambling to work with the caseworkers in that shelter to find other housing options while also providing emotional support to our clients because of the loss of housing, again, the lack of control, and also because the clients had been notified that a resident had tested positive for COVID, and so there was fear that other residents had been exposed to the virus. So through it all, our advocates are providing support. We feel hopeful and motivated with where clients like this client who was facing homelessness shared with our team that they look forward to their calls, that they feel like that's when they have some control and they feel supported. But it is true that there are a lot of barriers that both our staff members are facing in terms of locating resources, and then obviously that our clients are facing because of the pandemic. Next slide, please. So I'm not going to go through all of this table, but I just wanted to illustrate very much in line with the patterns that we're seeing across the country and how the pandemic, COVID directly has impacted communities of color. That in the different offices that we serve, you will see, for example, in California, where those who identify as Hispanic or Latinx, they represent 39% of the state's population, yet amongst those who are dying due to COVID, they represent 49% of those who are dying because of COVID. In the District of Columbia, those who identify as Black, and just to clarify, we represent clients from over 60 countries around the world, and so we have a vast representation of clients who identify as Latinx, Black, or both, very diverse clientele in terms of race and ethnicity. And so, for example, in the District of Columbia, where we may have clients who identify as Black, 47% of the population of the district is Black, but they represent 75% of the deaths due to COVID. And so that's an incredible or disproportionate amount. In Texas, our Hispanic or Latinx population represents 39% of the state's population, yet they are 56% of the deaths due to COVID. And so again, the huge disparity and all of which it implies, right, with the increased lack of access to healthcare, economic accessibility, housing, and inability to self-isolate, which is something that we are also seeing with our clients. Next slide, please. What does this mean concretely for our staff and what we see in a day-to-day basis? So over the last 6 months, we have seen an increase by 370% on the number of times that our clients are asking for support for basic needs. We have seen a more than 300% increase in the request for referrals to food banks in different communities. We have also seen a 640% jump in terms of clients requesting financial assistance to support with either housing or medical emergencies, seeking safety, right? Being able to provide, or when shelters are not available, being able to provide a hotel stay so that they can be safe and escape a violent situation. And by the end of June, which is when our second quarter ended, 228 clients had reported that they had been impacted directly by COVID. So all of this means that our staff is spending a lot of time and resources helping survivors navigate crises, whether it's mental health concerns, facing eviction. We are helping clients navigate systems like the healthcare system and really making sure that they are able to identify the few resources that are still available, that they are connected to them, and that we are making sure that if there's a language barrier, a cultural barrier, that we are there advocating for our client all the way. And then one thing that I forgot to mention that is really important, and a huge shout out for our social work interns and our interns overall earlier this summer, because what we also saw is that we serve the entire family unit, and with that comes being able to respond to the needs of our clients' children. And so we have also noticed that children are also being impacted disproportionately by the pandemic, right? Their routines were disrupted, their ability to see their friends in school, be present, that was all disrupted. And if for those who work with children, you know that children thrive and feel safe when there's structure and when there's routine. And so we did notice early in the summer that there was a family, for example, whose 5-year-old was experiencing self-harming behaviors. And so we had to pivot really quickly to start asking our clients, how are your children doing? How are you talking to your children about the pandemic? And really making sure that they had the resources and that they felt supported and knew that they could come to us in case there was a need with their children as well. Next slide. And then I think, it's true that the pandemic has come and impacted our clients in many different ways, but let's not forget that gender-based violence is a public health concern, is a pandemic in and of itself, and that prior to COVID, survivors were already more vulnerable to the negative short and long-term healthcare outcomes because of the violence that they've experienced and all the other forms of oppression that they are experiencing because of their intersecting identities. And so we know that in terms of their health, survivors are more likely to experience injury. They are more likely to have chronic health problems. It's why our staff, our social services staff in particular, spend a lot of time with clients who are in and out of the hospital. Our clients are more likely to experience depression, post-traumatic stress. There are more higher rates of they are exposed at higher rates to sexually transmitted diseases, 3 times more likely to experience gynecological problems, and we know that violence has a detrimental effect on the health of mothers and infants. And so really COVID has come to compound those inequities and exacerbate the violence and the oppression that our immigrant survivors are facing. Next slide. I'm going to turn it over to my colleague Chelsea now to talk a little bit more about immigration system.
Great, thank you, Adriana. So there have been a lot of changes and attacks to the immigration system, the legal immigration system, over the past few years, and it has not slowed down in this past year. One of the things that I think is the most striking and the most horrible to me is actually that cases are being paused right now. So if a client had an asylum hearing before an immigration judge or before an immigration officer, in the first few months of the COVID pandemic, everything was shut down, everything was closed, and all of those cases were rescheduled. And that's still going on now. They're kind of catching up, so everything's getting rescheduled. If a client qualified for asylum a few months ago, the day of their hearing, they may no longer qualify for asylum when they have their new hearing coming up. And that's because there are so many changes happening and being proposed to asylum law that by the time they actually have their day in court that they should have already had, they may no longer fit the definition of asylum and they could end up being deported. Which is just really, really hard, because if COVID had not happened, if they had their court date when they were supposed to have their court date, they would have won asylum, they would be here, they would be safe, they would be okay. But because their case is getting moved or continued or postponed, by that time, through no fault of their own, the laws may have changed and they may no longer qualify. So that's a really, really horrible, horrible element here that our clients are having to reckon with, that they're having to find out about and deal with and know that that's the new truth for them. There is also, during this time, of course, everybody is incredibly stressed, incredibly overwhelmed, trying to work if they can, trying to find out how they're going to take care of their family, bringing their children to doctor's appointments, how they're going to feed everyone, a million different things on their mind. And ICE is continuing with removal operations. There's actually potentially going to be even more coming up in the next couple of weeks, where ICE is going out of their way to come into communities and do raids on people who may have, the only thing in their background is that they're here without papers. It's not necessarily anyone with a criminal history. It's not necessarily anyone who poses a threat to the community. Any of our clients, most of our clients who don't have any kind of status yet, could be the victim of an ICE raid any day now while they're trying to balance everything with COVID. Other issues that we're having with, in terms of legal updates, there is a difficulty for some clients to be able to pay for their legal forms now. If they are out of work, if they have family members who are out of work who they're now having to support, if they have to shift their financial priorities, they might no longer be able to pay for the fees for their application. And simultaneously, USCIS has been denying at an unprecedented rate fee waiver requests. So now the clients are finding themselves in a position where they're not allowed to get a fee waiver. USCIS is denying it. They are out of work because of COVID, so they can't afford to pay the fee. So they're kind of stuck in this in between where they're just waiting until they're able to afford the fee to even be able to continue with their legal remedies. We also have clients who are being affected in terms of being able to reunite with their family. We have to pause consular processing, which is where if we are able to get a visa for a family member here in the US, and we want to bring that family member to the US now that they have a visa, there's a process called consular processing where they have to go to the embassy and they have an interview, and then they're allowed to come here, they have their visa, and they're allowed to start their life here. Most of the embassies are closed right now because of COVID. So we're seeing that so many of our clients are not able to reunite with their family members because the embassy is closed for interviews, and they're not doing online interviews, they're not doing virtual interviews. And unfortunately, we've already seen some really horrific things happening, some really terrible crimes happening to the clients who are waiting to come to the US and should already be here with their family, if not for COVID shutting down the embassies. So there's a lot of different stresses that the clients are going through on top of everything that we all have to deal with COVID, between everything that Adriana shared and now all these additional legal hurdles that they have to contend with. So this is a really, really difficult time.
Chelsea and Adriana, again, thank you so much for sharing your time with us today. There were a few questions in the chat that I'd love to share with you all in a little bit, and also invite folks to post in the chat other questions you may have at this time. Before we dive into those questions, I also wanted to share a few resources we've developed, including a written analysis of the impact of COVID on immigrant survivors, which we'll post in the chat, that you can read and are welcome to share with your networks. Next slide, please. We also have 3 more e-learnings in this series between now and early December. The next one is titled Threats to Gender-Based Asylum by our National Policy Team, to go more in depth on some of the information Chelsea covered about changes to the immigration legal system, particularly asylum. And then our Tech Access project, hosted by our San Francisco Bay Area office, will highlight some of the innovative work that they're doing and partnering with tech companies in the area to serve our clients and immigrant communities. And then finally, on December 2nd, we'll be doing a virtual screening of the HBO documentary Torn Apart, and that's hosted by our Atlanta office, about families who are separated at the US-Mexico border, and features one of Tahirih's clients, Vilma, and her young daughter. Next slide, please. So finally, as I mentioned at the beginning, this e-learning series is part of our annual Bighearted campaign, which sustains our work, particularly during this time, and allows us to continue providing direct relief, representation, and support to survivors of violence and the immigrant communities we serve. And so we'd love for you to visit our Bighearted webpage to learn more about how you can donate, share, or start your own fundraiser. And you can also find the registration link for that, for the rest of the e-series on that page, and we'll post that link in the chat. So now we'll stop presenting and turn on our cameras to answer. I think we might have time for a couple of questions. I'll wait for Adriana if she's able to join us on camera. Wonderful. So to either of you, what is the impact on clients who do not use English as their primary language?
That's a really great question. I think I think a lot of our clients don't speak English, and so our staff are having to provide interpretation services. We do, many of our staff members speak many different languages, and so we are lucky in that we are able to provide in-house interpretation for a lot of our clients. So we spend a lot of time navigating systems with them, calling with them, modeling how to ask questions, and a lot of our time and resources go on making sure that that language is not a barrier for them to access services that they need.
Yeah, I agree. And I just encourage everyone to think of how stressful things would be if you're going through everything you're already going through and then it's in a different language. So for example, we have one client who's facing eviction because of payments that he couldn't make during COVID when he wasn't able to work. So imagine going through an eviction process with 4 children in the middle of COVID, and then you don't speak the language of all the legal things happening around you. It's so stressful.
And then I think the other thing, oh, sorry, I was going to say the other thing I will add is that it's not just necessarily language, but we have some of our clients who are not literate. And so they are having to navigate systems, and it's not just the fact that they can't read and write English, it's that they can't read and write, period. And so that is also one of the things that we try to make sure that for those clients, we spend extra time making sure that we have technology that's accessible so that they can send us paperwork and we can read it for them, make sure that we explain to them what's actually happening, what are people requesting of them, so that they are not stressed because they are getting all these documents and they are not aware of what is actually happening with whether it's health-wise, their legal case, etc. It's just making sure that there is accessibility all around.
Thank you both. One final question. What are some more specific examples of how Tahirih is addressing the huge increase of survivors needing access to basic needs?
Yeah. I mean, we are, our staff members would tell you that we are constantly on the phone trying to identify, build relationships with different providers. And that's at the local level. I know that different offices have different advocacy projects working with local governments to make sure that we are increasing access, that if there are any relief efforts, that immigrant survivors and immigrant communities in general are not being forgotten. And then at the national level, I know our policy team is working on in a coalition of organizations who are specifically trying to advocate for survivors of gender-based violence. And so they are making sure that in every space where there is talk of relief, that immigrant survivors are not forgotten, that there is language there, that protections are not taken away from survivors, and that really emphasizing that that survivors are here, that survivors deserve protection, and just like anyone else, we need to make sure that they have access to basic needs.
And something that I appreciated that we did was, especially right in the very beginning of the pandemic, we kind of had an all hands on deck, and people from every discipline at Tahirih, finance, national team, whoever it was, all pitched in to contact every single one of our clients. I believe we were able to do, to see what their needs were and see if we were able to address them. So I think within those first few months, at least in DC, we were able to send out so many boxes of sanitary supplies, toilet paper when there was the shortage. Some people needed clothes, school supplies now that kids are going back to school. So we've been able to actually mail them to clients' homes, because many of them have immunocompromised family members and they are not able to take the risk of leaving their house to get some of the supplies, even if they could afford it and had it readily available.
Yeah, and those efforts are ongoing in their different offices.
Wonderful. Well, thank you both for joining us today, and we really appreciate everyone on the call and encourage you, please feel free to reach out with any questions. Hope you all have a wonderful day.